Hello, and welcome to the 2013 Consumer Participation Outreach Project Surveyor Training. The Consumer Participation Outreach Project is a joint project of the National Healthcare for the Homeless Council and the National Consumer Advisory Board, made possible in part by funding from the Health Resources and Services Administration. My name is Dan Rabbit, staff at the Council, and I will be co-presenting today's training with Brian Zralik, our consumer advocate here at the National Healthcare for the Homeless Council. The purpose of the training is to ensure that all consumer surveyors are familiar with basic survey research and the survey tool to be used this year. After viewing the training, please click on the link to the evaluation located below the recording of the video on our homepage or on our website. Completing the survey will be how we at the Council confirm that you are properly trained and ready to go out into the field to conduct the survey. Both Brian and I will follow up with each site after they have watched this training video and answer any questions you may have. Please make note of any questions as you view the video so that they can be addressed when we talk to you in person. So with that, we're going to get started. Probably one of the most important things about participating in the Consumer Participation Outreach Project is to work with your local Healthcare for the Homeless project. Their support is essential. Make sure that your project agrees to assist you and knows that you are participating in this project. Communicate with staff about your needs and concerns. Make sure that there is a safe place to keep supplies and completed surveys, and make sure that your local Healthcare for the Homeless project is willing to help you out with supplies, particularly stationery like pens, clipboards, copier, things of that sort. In addition to watching this training video, we ask that you obtain a couple folders just to keep organized as you go out and survey consumers out in the field. It can be pretty easy to get things mixed up. So we suggest that you have two folders, one for blank surveys and one for completed surveys. We also ask that you have a notepad to jot down any unique experiences that you have while conducting the survey. This will add to the report that we end up writing after the completion of the survey. And then, as mentioned before, pens and clipboards are essential. Participants, those consumers who agree to do the survey, should get a copy of the survey that's actually not true. Really, the only thing that participants should receive is a list of local resources if they choose to ask for it. The surveys are for the surveyors themselves to read to the participants. So that's how that should work. Each city should try to survey at least 75 consumers. That might sound like a lot, but if there are several consumer volunteers that are willing to help administer the survey, it actually can go pretty quickly. So to start, we would suggest printing out 80 copies of the survey. The survey will be emailed to you upon request, sometime shortly after watching this video, if you haven't received it already. And 80 copies to start. We ask that you complete no more than 75 surveys just to make data entry and data analysis more manageable for Council staff. The deadline for completing the surveys is February 28th, 2013. So if you complete 75 well before that, that's great. Thank you for your help. You can stop going out to survey at that point. If you're having trouble surveying that many people and the deadline is approaching, please be in contact with Brian or myself so that we can problem solve with you to see how to reach the 75 completed surveys. In planning and scheduling, we suggest using really more of a convenience sample for identifying and surveying consumers. So the first go-to place really that we would suggest is the lobby of your HCH clinic. In addition, shelters, drop-in centers, resource centers, soup kitchens, areas in the community that individuals experiencing homelessness congregate, maybe libraries or a park. All of these are great places to go and survey consumers. Make sure to really only go where you feel safe and comfortable, though. Safety is the #1 priority. If there are several consumers who are volunteering to administer the survey at your site, consider going in pairs or groups. This will probably make the experience more enjoyable for you. It'll add to safety, and you'll be there to support each other if questions come up. Plan ahead, please, and don't wait till the last minute. We set the deadline as February 28th, but the sooner you can get out there and complete the surveys, the sooner they'll be completed, and the more peace of mind we'll all have. When you're on site conducting the surveys, please use your best judgment to maintain safety. If you're uncomfortable approaching a particular individual, simply do not approach them. Another really important thing to emphasize is that the survey should only be administered by consumers. We really appreciate the support of HCH project staff, but a really central component of the Consumer Participation Outreach Project for the many years we've been doing it is that it should be consumer-driven. It should be consumers interviewing and surveying other consumers. We really feel that this makes sure that the quality of the information and the level of comfort between surveyor and participant is the best it can be. If a clinical issue or material need is brought up by the participant, so that could be an issue with a medical problem or a mental health concern or a medication problem or need for food, shelter, clothing, please offer the participant a copy of the resource list. Brian and I will help each site develop or identify an already existing resource list after the training has been completed by the surveyors. So you all have that list. Please offer that list to anybody who brings up any concern, but do not make any clinical decisions yourself. That should be left to clinical professionals. So if somebody asks what kind of medication they should be taking or what kind of health behaviors or decisions or nutrition is important to address a given health problem, please refer to professionals and don't make those decisions or give that advice yourself. And talking to potential participants, approach them in a non-threatening way, respect their privacy and their right to decline to do the survey. Introduce yourself, give a brief description of the survey, and again, emphasize that it is completely voluntary. We have here just a sample introduction. Please be natural. You don't have to read this off of a page or anything. But just for example, an approach could be, "Hi, my name is Dan. I'm a homeless person helping the local Healthcare for the Homeless program improve their services by conducting a survey of other individuals' experiences of homelessness. The focus of the survey is services which help people get health care services like outreach, transportation, and language interpretation. Several other communities around the country are also doing the survey. Would you like to complete a short survey on this topic? I won't ask for any name or contact information, and all your answers will remain confidential." That's just one example. It doesn't have to necessarily be that long, but just be natural and respectful of the people that you're surveying. The eligibility criteria for participating in the survey is pretty simple. Mostly it is you must be an adult, 18 years or older, you must be able to understand the instructions, and you must be currently homeless. And we here at Healthcare for the Homeless employ a broader definition. So it could be living on the streets, shelters, transitional housing, or doubled up. So if you're living in an unstable situation, even if it is in a house or residence, if you're sleeping on the couch of a friend or a family member, that's still considered homeless under our definition. Very important is to obtain consent to participate. This is a completely voluntary survey, and this is really one of the more essential aspects to doing survey research. If an individual indicates that they're interested in participating, you should then read the introduction and informed consent, which is listed on the survey. Brian will go over that explicitly in just a little bit in the second half of our training. Make sure that they understand it, ask if they have any questions, and as long as they agree verbally to participate and that they understand the informed consent paragraph on the survey, then you can proceed to administering the questions. Another thing to keep in mind is that most individuals who've experienced homelessness have experienced some trauma somewhere along the way. So we encourage trauma-informed interviewing. This plays out in a couple ways. One is to try to maintain privacy. I know if you're out on the street or in a busy lobby, this can be difficult, but do your best to have a one-on-one interview. Don't talk really loudly, and make sure that people feel that their information and answers are not being broadcasted to anybody who might be standing nearby. Also ensure the space feels safe. This is done pretty simply, but don't block people in. Don't close the door behind you. Make sure that people feel comfortable. We would also probably encourage not to go out at night if you can avoid it. And then just be aware of kind of your positioning to the survey participants. Don't kind of tower over them if they're sitting down. Don't stand up on a curb if they're down below the curb. Try to maintain the same height level, within reason, of course. When collecting the data, please circle all the responses of the participant. Go over the survey with them. We're not giving the survey to the participant to fill out in their own time and return later. We want the surveyors to read each question to the participant. Also, if any interesting or confusing or anything of note occurs, please feel free to write it down in your separate notepad or even on the survey itself, just for our purposes in reporting the experience of doing the survey. Once you've collected the data, please make sure to keep them organized. As you're going through the survey, make sure that any questions that the participants have are answered. Make sure that participants know that they don't have to answer every question. If they're uncomfortable answering a question or want to skip a question or several questions for any reason, that is up to them. And again, remember that you have your resource list to offer to people who have questions about where to access local resources. If any trouble occurs or you're having difficulty with anything, please be in touch with myself or Brian. As mentioned earlier, once you complete this training video and the attached survey evaluation, either Brian or I will be in touch with you just to make sure that everything is good to go and you don't have any questions, or to answer any questions that you do have. But if some other things come up along the way, please do not hesitate to call either of us. Just for simplicity, we're going to try to assign each site to either myself or Brian, just so you have a particular point of contact. But really, either one of us should be available to answer any questions anywhere along the way. So please do not hesitate to contact us. Once the surveys are completed, once you have your 75 completed surveys, please send all of the surveys to the council. The address is listed here. If you do not remember the address, you can always contact Brian or I, and we are happy to give it to you. With that, I'm going to pass it over to Brian, and Thank you so much for your time.
Hello, this is Brian Zrolik. I will be going through the survey with you now, and as Dan was saying, this consumer participation outreach survey is related to enabling services, and so the survey is going to ask questions about healthcare services, types of enabling services that people maybe have received, and then try to look at the impact of those services. So we're glad that you're able to help us out. Glad that you're listening to us today. And the slides that you're going to see in this presentation are the exact same. It's the exact same information that's on the survey. So this is taken directly from there. So to begin with, we've got a few questions at the top related to the city, the date, and then just the title of the survey. And so when we're talking about the city for this survey, we're talking about the actual city. We're not talking about a neighborhood or a part of town. For example, if you live in Chicago, survey collection city would be Chicago and not Cicero or Humboldt Park. For New York, it would just be New York. It wouldn't be Queens or the Bronx. So when we're talking about city, that's what we're talking about, and it should be the same for all of your surveys that you do. The date is the date of the collection date when you are actually doing the survey. There's the title, the CPO Enabling Services Survey, and then just a statement there about the instructions. Throughout the survey, you're going to see instructions in brackets, just like that. Those instructions are for you to have in mind, and sometimes there will be information that you can share with the survey participant. You might be giving examples of certain things, medical conditions, types of services. So, introduction and informed consent. Again, this is for you to read to the participant. This is the introduction. It explains what the survey is for, what enabling services are, and how collecting this information will help the National Council and the National Consumer Advisory Board help us improve access to health care. That's the goal of this survey. Let the survey participant know that this survey is to be read aloud. That you'll be pretty much holding on to the piece of paper and reading from it and asking questions, getting responses from your survey participants. You can say something like, most of the questions are multiple choice questions. I will read the questions out loud and the answers out loud and ask you to tell me your answer. Some questions will also be open-ended, so they won't be multiple choice, and I'll point those out as we go along. The participant sometimes may just give you an answer before you even have a chance to give the answer options. What health concerns do you have? And before you can say medical, mental health, etc., the person says, I have chronic arthritis, which is a good answer, but you may need to go back and read the answers anyway, just to make sure they understand what all the options are. Again, don't give the survey out to the participant. You hold on to it, and you fill in the answers based on their responses. You'll note here that we are just surveying people who are currently homeless and who are 18 years old or older. As Dan said, being homeless can mean living in a shelter, a hospital, on the streets, or doubled up with friends. So that's one question. And then the question, are you over 18? If the answer to either of those questions is no, then that's the end of the survey. So it's just a matter of politely saying thank you, and this survey is just for people who are homeless and over 18. Now the informed consent, this is getting a verbal agreement from the participant so you know that they understand what this is about. So the informed consent explains that the participant does not have an obligation to take the survey. that the answers will be confidential, that there is no relationship between taking the survey and receiving services. So they are free to take this survey. They're not obligated to do it, though. The participant can skip any question at any time he or she does not want to answer a question. They can stop the survey at any time. You can also let them know that there's no payment for taking the survey. And if the participant needs help, either they say outright, I could use some help with housing, or if you sense that that's something that they need, you can let them know that you will be giving them a resource list at the end of the survey. If the participant agrees to this informed consent, then you can continue with the survey. And again, if he or she does not agree with this statement, then you can politely let them know that you won't be continuing with the survey. Okay, so moving on to demographic information. We want to know how much time the person has been homeless. You can read out the answer options, or they may just say 2 years. So you can circle the answer that corresponds with that. It may be good to read out the answers anyway, just so they understand kind of what we're talking about here. And then age in years, however old they say they are. Okay. We also want to know about race and ethnicity. What race does the participant identify themselves as? You're just going to want to check one answer or circle one answer. If the participant identifies several, such as Hispanic, African American, and Native American, then you can circle multiracial. If they identify just two races, like black and white, then mark biracial. Now, gender, this also depends on how they identify. You can read off the options for them and let them answer. It's all right if the participant does not want to answer that question or does not want to answer the question about race. Okay, now we're going to move on to the survey questions themselves. We want to start off by figuring out how survey participants see their health. It's hard to describe exactly what it means to have a quote-unquote excellent or fair state of health, but we're going to leave it up to the participant to say, yes, I feel like I have a poor state of health, or good, or very good, or excellent. So again, this is a situation where you're going to want to read off the actual answers, and they can respond to you, and just circle that answer. Here's a list of possible health problems. Again, this is a time where you're going to want to read off these answers. Medical, and you can give the examples of diabetes or heart condition, mental health, emotional health, depression, schizophrenia. Those are examples. And so some of it is pretty self-explanatory as well, but just circle all that apply for that answer. All right, now treatment. We're going to ask what sorts of health concerns have they gotten treatment for? And this is another one of those, check all that apply. Medical, mental health, substance use, dental health, vision, or maybe they're just not receiving any treatment right now. Another couple other questions about treatment, and these are open-ended questions. We want to know, in their words, why are they not getting treatment right now? And, maybe there's just something that they're not getting care for. Maybe they didn't answer anything in the last question. So, but just go ahead and start off by asking, if you have health needs in which you have not received treatment, tell us why you have not received these services. We also want to know what sort of health services would you want to receive that you're not now receiving. Again, those are open-ended. It's a time to give the participant a chance to just really describe in his or her own words what's going on. Now we're going to look at healthcare. where do you most often go for health care? And we're going to ask the participant to pick out the one place where they go to most often. So maybe they visit the emergency room every once in a while, but most of the time they're going to a community health center. So it's important to spell that out. We want to know, where do you go most of the time? Another thing to look at here is what we have in brackets. We're talking about the HCH project, the Healthcare for the Homeless project. Most folks are probably going to know what that is, but you may not know what that is. So part of this training and in preparing to do these surveys, it will be helpful for you to make sure that you know that. What is the name of the Healthcare for the Homeless project in your community? And Dan and I will also connect with you and make sure that you're aware of that. It's also going to be important here to read off all of the possible answers for this question. Insurance. This is another situation in which your state, whatever state you're in, will have its own particular Medicaid program. So Medicaid is called different things in different states. For example, in Tennessee, it's TennCare. In Oregon, it's the Oregon Health Plan. So we'll also try to help you ahead of time to identify the name of your state Medicaid program if you don't already know it. But when you read this question, it's going to be helpful to be able to say, do you have Medicaid, TennCare, or whatever the name of your state's insurance is, your Medicaid. And you can read all of these off. And if they have another type that's not listed, you can just write that one down. All right, now enabling services. This is kind of a long list, but it will require you to read off all of the answer options. The participant can answer yes to as many as he or she has received. So again, it's just circling the answers that correspond to their responses. Please say whether or not you have received any of the following services, read them out loud, and circle the yeses. And that will do it for that question. And there are answers with brackets next to them, so that's something that will can help explain what that is. What is health education? It's knowledge to help you improve your health, which is offered at community health centers. Okay, so enabling services and healthcare access. If you marked any of the above services, did the help you received allow you to get the care you had previously not been able to receive? Yes, no, or don't know. And 9A is also an open question. How did these services help you? What problem got better after you got those enabling services? So enabling services and healthcare access, part 2. This is another instance in which you're going to have to read these off. You may have these memorized by the end of this, but it's just, these are all enabling services that help people get connected to healthcare services. So it's the exact same information as 2 questions before. Read them all off, and with this question, we're actually asking for the top 3. So, which of these has the person relied on most? What has been most helpful? That's really the question, is what has been most helpful? And we're not asking that the participant rank, what's the top, what's the second, what's the third, but just to say, these 3 have really been helpful for me. So what other kinds of enabling services would improve your health and access to health services? That we have it's a pretty comprehensive list, but there may be something that's left out, or maybe they are not accessing those enabling services for some reason. So maybe they can say at that point, well, transportation really would be helpful. So it's just an open question about what would make things better and improve healthcare access. So that is a walk through our survey. lot of reading out loud and a lot of circling, but there's a lot of some skills that you need to do it, and we know that you've got that. We hope that this training has been helpful, and when you're done with the survey, you can say something like, thank you for your time, thank you for helping us out. Your information will help us work to improve healthcare services. Have a good day. It's also a time, though, to give out the resources list. Here's a list of resources to help you out. Thank you for your time. So that's what that's about. And we also are asking you at this point to, when you're done with this training that Dan and I are doing, we ask you to do the short online survey. And here is the link. It's the SurveyMonkey link there. It will confirm for us that you've taken the survey, and it may help us know what sort of questions that you're going to have coming into it. So that is it for us, and Dan and I will be in touch with you. You can also call us or get in touch with us in the meantime. Thank you for your time, and have a good day.